present some research from Belarusian researchers in the field of addiction medicine and also with field of public health. In Belarus, we have a huge problem with tobacco smoking. So we had to answer some question about prevention of smoking by the youngsters. I'd like to briefly describe our country. We are between Poland, Lithuania, and Latvia in one side, and Ukraine and Russia from the other side. I work at the clinical center. We are based for the central region of the Belarus, with a served population about 1.5 million persons, served for both for the addiction problems and mental health problems. And as I mentioned before, Belarus have a very high population level of tobacco consumption, and male population have more than 15% of the smokers. Sometimes we mention that more than half of average male population smoke every day and have problematic use. And Belarus have a great level of tobacco-related mortality compared to other countries of European region and globally. And you could see that we are very close to our neighboring countries. And as I mentioned, the main population have the most negative impact on the health because of the tobacco smoking, mostly of the cardiovascular and oncological diseases, but also from pulmonary diseases and other non-infection diseases. And young people also have a great proportion of smokers, but now I present international data, by then focus on our national data, and we still have, as you see, that prevalence is more than 20% in this young population, especially when people receive access to legal purchase of the tobacco at the age of 18 in our country. And in our country, we have a different project and focus mainly on new smokers and school programs, university programs, and general population program. Try to postpone the age of the smoker beginning, and then try to change the smoking behavior by the intervention primary care level and addiction service level. But now we have some challenges, and one challenge is alternative product like e-cigarettes or vape and heat-not-burn products, and it's very popular in our country, maybe as in other regions of the world. It's purchased legally in the general shops, but not permitted to purchase to the children under age of 18, and we have about maybe 3.5 million totally users both of vapes and electronic cigarettes. And some of the discussion increasingly in the media in our country, because sometimes electronic cigarette or vapes perceived as gateway, not gateway drug, because nicotine is the same as in tobacco, but gateway to the tobacco smoking. But at the other time, some person reported that they move from the tobacco to the vapes or to the heat-not-burn products and decrease the number of the smoking cigarettes per day. So this discussion is still on the top of the media in our country. And as we know before, that level of the consumption in youngsters not only before 18 is high, and testing of the cigarette and mean age of the testing is very lower. It's before 18. And but electronic cigarette more often try to use after the 18, and some of them not totally moved from the electronic cigarette to the traditional smoke, from the traditional smoking, sorry, to the electronic cigarette, but use both one and known as dual smokers. We know that heat-on-board products is also sometimes proposed as alternative for traditional cigarette smoking, but evidence is not so strong. It's only moderate effects of the changing of the smoking behavior. And more strong evidence for e-cigarettes in some countries like Great Britain proposed strategy of spreading e-cigarettes in primary healthcare, in specialized care, in addiction services, for example, for those who not stop the smoking. And as we know, e-cigarette is electronic device. There are some different types of e-cigarettes, and we know that heat-on-board is also electronic device, but use tobacco with not traditional burning, but with heating. And we strongly for the smoking cessation in cases if people desire and people will and prepare to change with support, with consultation. But some smokers not want to quiet. It's not easy to quiet because of strong level of the tobacco addiction. So we try to change risk and harms and move from the cigarette, as we see with the highest harm to the mortality, to the morbidity, and to the lowest parts. And we find that electronic cigarettes, oral products, heat-not-burn products has a lower risk, without no risk, but lower risk compared to traditionals. And youth choose vaping not only because of the taste, not only because of the nicotine per se, but also because of the social engagement. And we try to see how they change the patterns of the use of the smoking, cigarette and e-cigarette consumption through this specific population, focused mostly on the youngsters. We have a result of very huge studies. These studies is a methodology of the STEP, this prevalence of main risk factors, conducted by the support with WHO, but also with some results from the Global Youth Tobacco Surveys, which conducted recently in our country. And we try to change, to compare and make some correlation with data of the global youth tobacco surveys and young population inside the STEP surveys. Prevalence of current smoking in our country changed, as I reported before, but still very high, especially in males in age 18 to 96, but still higher, 1 in 3 male person in age 18 till 29 still smoke. And we also have some research of the sexology research and toxicology research about e-cigarettes and heated tobacco product. And some of the e-cigarettes and heated tobacco products users reported they tried to quiet smoking or smoke less and satisfy with lower level of the smoking on the electronic cigarettes or on heated tobacco products. And our toxicology also tried to examine the most harmful substances and aerosol and tobacco smoking and find the changes in the level of the carbohydrates, nitrosamines, what were specific for the risk of the oncological disorder. And so we also tried to examine the economic impact of the possible change from the routine cigarette use or common cigarettes to these novel projects, and find these changes was economically supported. And then we focus on the current smoking vaping, and we're also very worried about dual smoking and find that it's not so regular in the age groups, in the old age groups, but a little bit often in the young age group. And then young smokers increase in males. We could see that about 1 in 5 males smoke vaping, except maybe traditional cigarettes. And heated tobacco project is also not still popular as electronic cigarette, but also differences in by the gender, because it's very popular in the female groups compared to the male. And former smokers, because of the changes to the electronic cigarettes, is also a percentage of former smokers also increase compared to the previous studies, and not only in male groups, but then also in female groups, and mostly in females, sorry. And former electronic smokers mostly increase in females also. And we see that different age different age groups show different level of tobacco use, and about maybe 10 times decrease, about 10 times decrease in total tobacco smoking in the young groups, and number of smokeless tobacco increase, but not so strongly compared to decrease. It's not of the substitution effect, and former smokers has also changed from the 2015 to 2021. And electronic cigarette use is very high, but this is prevalence, 1 month prevalence who tries these cigarettes, but also we find that this prevalence is high in girls. So we try to make the correlation between this data from the 2015-2020 in adult population in age 18-24, and had not reveal any correlation. And we not also find any reports about population of heated tobacco product use in our youngster population. So we find that total consumption or total prevalence of smoking decrease, but we had no find substitution effect by the electronic cigarette or heated tobacco product, and find no correlation between decrease of the smoking prevalence in youngsters and spreading of electronic cigarette. Not statistically, but we find that totally the number of youngsters who try smoke or tobacco or electronic cigarette also decreased from 2015 to 2020. And I'd like to make acknowledgements to my colleagues and thank for your attention.